everybody, and welcome to the Thursday edition of Welcome Back to the Community Interview with Efwa Bromley. Efwa was my guest. I looked back, it was May 20th, and so very excited for her to be here. We'll talk about her in just a second. So if you've been curious what it's like to have acupuncture treatment and how it can help you, you are in the right place. And I'm wearing a mask today for the first time because every other live I've done has been in my house, so today I'm in an office, so this is exciting. Tonight, you're going to see an acupuncture treatment being done live on me. And Efwa's here to answer all questions. She's actually mic'd, so we'll be looking at questions as we go along. Tom, welcome. Ron, thank you for being here. So if we haven't met before, I'm not sure why we haven't met. It's been a couple months I've been doing these, but if we haven't met, my name is Dr. Michael Gorman. I'm a physical therapist, and I'm the owner of iMove PT. We have these twice a week. We'll talk about at the end of the show, just a slight change we're going to make in our Facebook Lives, but we'll do that at the end. But I always like these to be very interactive. So please give me thumbs up. If you like her putting needles in me, give her a heart sign or the wow emoji, but please make it interactive. And as always, if you have questions, please ask. The expert is here, the expert acupuncturist is here to answer your questions. I also want to know if you're watching this live or if you're watching this rebroadcast. So please, if you're watching this, well, obviously if you're watching this right now, you're live, because we are live, but type in whether it's live, and if you're watching this via rebroadcast, type that in so I know, please. As you guys know, I always have a community question. My question today is, are you afraid of needles? So let me know, please, if you are afraid of needles. I am not, which is why I am here, and I have no concerns about what Efwa is going to do for me today. So I want to welcome Efwa Bromley in. Please give her a warm emoji clap. You guys know how to do that. You see me do it all the time, so give her a warm emoji clap, and we are so grateful that you're back. Welcome. We were just talking about how life has been and how your practice has been and how things have, your patients, they've increased over the last couple, maybe month or so, but it's still very, very tough. So we're always thinking of you, and if we can get anybody your way, we are more than happy to.
Thank you. Thank you.
So could you please, we talked a lot about your amazing background last time, and I spent a couple minutes on that, but just let the audience know just about your educational career. I want to know, why did you choose to be, or why did you want to become an acupuncturist?
Yeah, I went to WashU undergrad, so I was pre-med, elementary ed, and African studies, and had taught for a couple years and had decided to go to medical school. Got in, but got waitlisted, and while I was waiting for the end of the year, waiting to hear whether I'd go for the following fall for medical school at University of Kentucky, or if I would do a post-baccalaureate program, I got sick. I lost my hearing in one of my ears, had been on the antibiotics. Nothing had helped. My doctor said, maybe you'll get your hearing back, but probably not. And a friend was dating an acupuncturist and harassed me into getting a treatment. So my first treatment was actually at a picnic table. And 5 minutes into the treatment, I could hear. And it just blew me away. And I was like, what did you do? And how did you do it? And he gave me a book to read on Japanese acupuncture. And I loved this book because it explained acupuncture more from kind of a quantum physics standpoint. And I had also been a chemistry major through most of undergrad. I didn't end up finishing that major, but the fact that it was explained from a physics standpoint, I'm like, this makes sense to me now. So I ended up being number 9 on the wait list, and they got to number 8. So I would be number 1 for the following year. And I said, this acupuncture thing is really interesting. Maybe I'll look into going to school rather than doing a post-baccalaureate program, because I've already done a lot of that coursework, and did some research, found a school that I really liked in Florida that was highly recommended. Went down to Florida, interviewed for school, got a job, found an apartment in 3 days. So apparently the universe wanted me to go to acupuncture school. So I moved to Florida, started school, and 2 months into school, I was like, the things that I'm seeing in clinic are just blowing me away. And decided to not go to Western Medical School, to which everyone was panicking. But to this day, my parents are like, we're so glad that you chose this path. And I am too. I've been in practice on 23 years. So,
23 years.
Yep.
Okay. And I believe I forgot to say, but the name of this practice is Acupuncture St. Louis and Wellness Center. So we're in Webster Groves, Missouri. And she gave me a tour of the office before we got started. It's beautiful. And so she's in Webster Groves. Okay, so let's talk about tension headaches, because
Yes.
on the live that I had on Monday, that was really what we talked about, and did different treatment options. So I am a physical therapist,
Right.
and I definitely believe that physical therapy is very effective, but it doesn't. People need options, because not one thing is the panacea for everyone. Most times, to get people better, you need a series of different treatments. So, how can acupuncture help with tension headaches?
So most tension headaches are just that, they're tension based. So the muscle tension typically in the shoulders, the back of the neck, and into the jaw, depending on if for people who have TMJ. So with acupuncture, one of the things that we do and that acupuncture does is it does help locally. You can use it to help relax the muscles around it, around the area. So typically when I'm treating for tension headaches, I will do a number of local points. There are also what we call distal points, and these are points further away. For example, there's 2 that are near the ankle for tension headaches that help the muscles to relax. And that's based on the meridian system. So that's these pathways of energy that we say if they get blocked, either too much, too little, or a block in energy causes muscle tension and could cause disease or dis-ease, different health issues. So tension headaches are mostly working kind of in and around this area. In Chinese medicine, we'd say a lot of times it's liver and gallbladder, particularly the gallbladder channel. It doesn't mean you have gallbladder problems, but it's along that course. So it's very effective. And typically I'll also do something called Tui Na, which is Chinese body work, and cupping, which I'll demonstrate today too.
Awesome. What about acupuncture contraindications?
Yes.
And not just for this, but for any acupuncture.
Right. So luckily there's very few. So typically if somebody is very weak, then somebody who's extremely sick, you have to be very careful. You can do acupuncture sometimes, but you have to be careful. There are certain acupuncture points that are contraindicated for pregnancy because they can induce labor. Then I would say probably the biggest one is people who have vasovagal response, which means they tend to faint if they're poked with a needle. But usually they know that because most people have gotten shots before. So they know if they tend to faint. So yeah.
What about if someone's on a blood thinner?
Not a problem.
Oh, good.
So blood thinners are not a problem. Occasionally you'll get like what we call bleeder, which is literally there's a drop of blood, but our needles are so thin that typically none of them bleed. So blood thinners are not a problem. There's no contraindications for people doing chemotherapy, other autoimmune or immunosuppressant therapy. No contraindications actually, both pre and post surgery. We may choose to not work on a physical particular area if it's close to an incision site, but other than that, I mean, it's one of the great things that there are very few contraindications.
How about, is it contraindication if someone has a farmer's tan?
Well,
I just I don't know, it may not be too bad, but I want to know because I have to take my shirt off.
Yeah, everybody's just going to see your farmer's tan. You're just going to be out of luck on that one.
Okay. How long, if I have headaches and neck pain, what's a typical length of treatment?
So in terms of the actual session, typically once you're on the table, usually treatments are anywhere from 20 to 40 minutes, kind of depending on what's going on and Some people tolerate needles for longer than others. I have some people that really 2 minutes is all they need, and other people that we work longer, but that's kind of based on your constitution. And then in terms of length of sessions or number of sessions, it depends on how people respond. So I have people who I might see once or twice, and it really resolves their issue. And other people, especially nowadays with so many people doing computer work, where you're constantly sitting and you're hunched over, a lot of times you're kind of chronically re-injuring the muscles in your neck. So I would say most people, it's somewhere between 4 to 6 sessions. Certainly if you've got some structural issues, loss of either disc space, degenerative disc disease, those things are a little bit more complex because I can't bring that back.
Right.
And if you've had surgery, it still really helps, but that scar tissue caused by neck or back surgery often is an issue, so I'm often working on the scar tissue to decrease that too.
Okay. I was going to ask you a question. What will I feel? Will I feel like an endorphin release or?
Different people have different results. Most people just feel very relaxed. Some people will feel, one of my patients described it as, it feels like warm oil flowing on my back. So it can be anywhere from that. Some people feel tingling. Most people just feel relaxed, and a lot of people fall asleep.
Well, it's a good thing I'm going to be on my stomach, because if I was on my back, you may hear me snore. So I'm glad that we're going to do this on my stomach. Okay.
Yeah.
Anything else the audience needs to know before we get started?
Sure. I think the biggest thing that people ask often if they've never had acupuncture is, does it hurt? The needles are really thin, so it really doesn't hurt. The most that you might feel is a tiny pinch, less than a mosquito bite, and usually that dissipates like right away.
Okay.
So that is often people's biggest issue. A lot of times people will be laying on the table, and I'm explaining the points as I do them, and they're like, when are you going to start? And I'm like, I'm done. You've got 15 needles in you. So, and a lot of people are surprised because you really can't really tell. So,
okay, nice,
yeah.
Nice. So I don't frequently get headaches, but when I do, it's like after a long day on the computer. Yeah. And it's kind of frontal, sometimes here.
Yeah.
And if I do get neck pain, it's right-sided. Again, not frequent, but...
Yeah. So a lot of what we'll be doing then is kind of what I described. So more neck and shoulders. I will do some points around the ankle. And then I will probably do some scalp points too, because people forget their muscles that go on the scalp, and it can be like a vice grip, and the longer you're on the computer, the tighter this gets. So we'll do some points there too. Then I'll do some cupping and some massage, and I will also show you some acupressure points that you can also use for, that way you can treat yourself too in between.
Awesome.
So
that's great.
Awesome.
Are we ready?
You ready?
Yeah, I'm ready.
No, we're ready.
Okay.
All right.
Let me see real quick. I'm going to see if we have. Sorry, guys. As you know, sometimes my vision's not too good. All right, Emily's on. Welcome, Emily, for being here. Thank you. I already said Tom, Ron. Nicole's on. Welcome back, Nicole. Where you been, girl? Where you been? It's been a while since we've seen you. Danielle, this is her first time in the audience. Thank you, Danielle. Clinton is here. Oh my gosh. Clinton, hold on. Clinton, I haven't seen you forever. Thank you for being here. Alexander, thank you for being here. I think it's your first time in the audience. Michael, our old friend Michael, who won. He took some money from me today at golf. Not as much as normal, but thank you for being here. And Ron, okay. And Sean's here. Thank you guys for being on. I'm going to move the camera here, so don't get dizzy, everyone. I'm going to move the camera.
And I'm going to grab some equipment.
Okay. All right. I think that's going to be good. Yes, I think we're good here. So everyone just sit tight for just a second.
You can't see me, but I am gathering needle supplies and sanitizing my hands again and grabbing some alcohol to go on a cotton ball. So this part this is part of clean needle technique. And one of the things that we have to do, because we are inserting, I am inserting needles into Mike here. So
are you laughing at my farmer's tan? She is.
You guys get the view in a second.
Not very pretty, but we'll do this anyway. Okay. All right. So face down, right?
So we're going to have you go face down, and I'll adjust this in a second. We'll make sure. Perfect.
And I can bring the mask down?
You can bring the mask down because we want you to be able to breathe.
Okay.
Okay. Now, is this down enough? Do I need to adjust this at all?
Maybe down just
down
just
a little
tiny
bit?
bit.
Absolutely.
Just a tiny bit.
Okay. See how that is, and then I may actually lower that stool some.
Okay.
Is that comfortable?
Yep.
Down a little bit more? We're
that...
doing fine camera-wise. Yep.
Okay.
Looks like all of you can see. So the first thing I'm going to do is I'm going to swab some points that I'm going to needle. So when I'm choosing acupuncture points, I am choosing some specific points on the body. The way that we measure to find these acupuncture points are based on everybody's personal physical structure. So I use landmarks. So here, the base of the occiput. I'm going to go into the scapula here, and I'm just kind of poking around to see where most of the tension is.
Are you trying to find the fat rolls?
Not trying to find the fat rolls for you.
All right, all right.
So I do use stainless steel disposable needles. There's no medicine on these needles. They are literally it's just wire that's been honed. So I use a small plastic guide tube, which is probably too small for you all to see. And then we're going to do, and I'm measuring here, these points. So again, because everything is connected to everything else, even though I talked about the tension headaches, and often it's the base of the occiput here that's really tight, if I don't loosen all of this up, this is going to still remain tight. So I'm measuring here. And because I don't want to give him a pneumothorax, I'm going to needle obliquely because you can puncture the lungs. And this is why you always get a board-certified acupuncturist, nationally board-certified and licensed for the state wherever you are, because you want to make sure that the person who is needling you actually knows what they are doing. All right, here. Okay. So I'm going to put these to the side for now, and we are going to do a couple at the base here. And again, I'm going along the scalp. He is not screaming yet, so I think he's pretty good. Are you doing okay?
Are they in?
They're in.
How many do you have in me?
You have 8 in you right now.
Oh my God, I really cannot even see. Seriously.
Now we're up to 10.
That one I could feel.
Okay. So sometimes you'll get a little bit of a zinger. Has it gone away though?
Yeah.
Okay. So sometimes I talked about that. You might have a little bit of a pinch and then it goes away. All right. So I'm going to check a couple points. I'm going to check a point on your hand. Any tenderness here?
No.
Great. Okay. I'm going to check another point here on the hand. Any tenderness there?
No.
All right. Great. So I'm going to go down to his ankle. So I'm going to describe it just because I don't want to lose the particular picture. Any tenderness right here?
No.
Okay. And any tenderness here?
No.
Okay. So we're going to skip those 2 points. And I think you all can see these. So I'm going to kind of point because the needles can be hard to see. They are that thin. So these are where the needles are. We've got 4 back here. So, doing okay so far? All righty. So normally we would leave these in for typically about 20 minutes. Most people fall asleep. A lot of people get really relaxed. How are you feeling? Are you feeling anything different?
No, I'm doing good.
Yeah. So one of the things that the acupuncture needles do is they kind of calm down the sympathetic nervous system, which controls kind of that adrenaline response. stimulates the parasympathetic nervous system so that you kind of relax, your body just kind of lets go. So normally, like I said, I would leave these in for longer, but today we're actually going to take these out so I can give you the little bit more of a variety of experience. And I'll show you some cupping. So to take the needles out, we are going to just pull these, and then these will go into my medical waste sharps container. See, no blood. He's not bleeding profusely or at all. And then we're going to do a little bit of massage and cupping. So with cupping, and I'm going to put some massage oil here. So these are a cup. So I've got a cup and a pump here. And what this does is it works on the deeper layers of muscle tissue to help loosen it up. So I'm going to go along the spine and use, this is called moving cupping. So a lot of times for tension, any kind of tension, muscle tension, headaches, shoulder pain, neck pain, I'll do moving cupping to work a larger area. That way, when I do the manual massage on the neck, he'll have basically longer lasting results. So the cupping helps me to work those deep layers. And you all can see with the cupping, looks like somebody ran road tracks on his back.
Is this what the Olympic swimmers?
Yes, this is what Michael Phelps at the last Summer Olympics, this is what he did. Works really well. I was telling Michael, helps with golf swings. I have a lot of people who come in before a golf tournament because they swear they play better. So maybe you won't get taken so much.
There you go. Yeah, that one guy takes me all the time.
All right, so you can see, so the way that you know that he's got a lot of muscle tension is you're going to see the redness. If he didn't have a lot of tension in his back, this would not be red at all. So then afterwards, we'll do a little bit of working the neck.
So I'm curious, was it more red on the left or the right?
It's about equal.
About equal, okay.
Up on the left, up into the shoulder. Here, a little more red.
Yeah.
Here, it's kind of mid-thoracic.
Okay, because it definitely felt more tender on the left.
Yeah. So slightly uncomfortable is okay. Painful is not. You know, as he said, slightly uncomfortable. But 5 minutes of cupping equals about a good hour of deep tissue massage. So cupping is amazing. Okay, so we are going to wipe off some of that oil. And then I'm going to let you see if there are questions that people have. So you're going to need to get up slowly. We don't need you passing out.
Okay.
And then I'll demonstrate some acupressure points.
Will I be prone or supine?
You are going to be sitting up then.
Okay. Oh. So should I put my shirt on?
You can put your shirt on.
Okay.
I'll even hand it to you.
All
He
right.
doesn't want you to see all of his farmer's tan.
Yeah, I don't want to embarrass myself too much. Okay, let's see here, guys. That cupping was really awesome.
Yeah.
Really awesome.
Yeah. Cupping is still my favorite.
And, you know, it's probably easier on your hands, right?
Oh, yeah.
Cupping than
Yes.
to do deep tissue?
Yes, it is.
Oh, that's awesome.
All right, so do we need to
Yeah,
move
let's
that?
See what we got here. I got to adjust my eyes. All right. So, my father, Ron, says, can I insert the needles in the
No, we like you. We want to keep them around.
I gave him a lot of grief growing up, so he probably wants to get back to me. Hello, Marie Feldman from out in California. Thank you for being here. Tom, okay, so Tom asked a question. He said, FY, why did you assess the distal area, Mike's hands and ankles for tenderness. Why'd you do that?
Because a lot of times, if there is tenderness at that point, it means that there's more blockage there. So you'll needle that, basically release the chi there, and it unblocks the whole channel. So my experience, those points are most effective when they're actually tender.
Okay, is that why you didn't do anything?
That's why I didn't do anything to them, because you had no tenderness there.
Okay.
Yeah.
All right, cool, awesome. Megan Normal's on. Megan is a fantastic physical therapist. She works at SSM. She is a women's health therapist. Fantastic. Thank you, Megan, for being here. All right, no other questions. So what's next on the
All right. So now we're going to go through a couple acupressure points. So
okay.
if I can have your hand. So when you have a headache or a tension headache, one of the main points that's kind of you can just do yourself is between the thumb and index finger, right in the meat of this muscle here.
That is very tender.
And that's tender. So,
yeah.
So this one, if you're in the midst of a headache, if you have sinus issues, it actually helps with a lot of things. It induces labor, so don't do it if you're pregnant. But massaging this point for up to about 30 seconds. It also does help with neck tension, so all I'm doing is using pretty firm pressure, but just massaging it. So I think everybody can see that.
Yeah.
All right, so usually with this point, you check both hands. One hand will be more tender than the other hand. That's a hand that you press.
Dude, I'm just curious.
Yeah, absolutely. So I think this one was a little bit more tender.
Yeah.
So literally the muscle gets tighter, the more blockage is along there. So this channel we say is the large intestine channel, and it actually goes up and ends on the face.
Okay.
So you're treating a distal point for head and neck issues.
Okay. Does it, so I'm left-handed, does it coincide with, no?
No,
okay.
It doesn't. It really depends on which side is more blocked. So that's for tension headaches. Then the other one that you can do for neck pain is if you make a loose fist, and I might have you turn that way. So this, at the end of the this juncture right here, that helps to release the neck. So if your neck is really bothering you too, you actually just want to press in. Again, check both sides. One side will be more tender than the other, and it'll help. So this works well for occipital headaches. So frontal headaches, this also helps kind of with the temporal headaches and apex headaches. This one really works primarily for occipital headaches.
And do you just hold that pressure?
And so you're just going to hold it. For usually 30 seconds is enough to stimulate it. I'd press in pretty deep into the bone, down in, but literally people say you can literally feel the headache dissipate.
And so if I have right-sided headaches, would it make sense that this is...
It's usually your left side. Usually it's opposite. So if it's your right side, always check your left side first and vice versa. However, that is usually the rule. There's always exceptions to that.
Right.
I have a couple people who it's always their same side. They are not the norm, but so that's why I always check both sides for tenderness. Even if you tell me and I'm pretty sure it's going to be one side, I usually will go the opposite side.
Okay. That's really awesome.
Yeah.
That's
so
awesome.
Now you guys all know how to do acupressure.
Oh, that is so cool. So I wanted you guys, if you live in St. Louis, and even if you don't live in St. Louis, you can always travel.
Yeah.
You can drive. I don't know about flying. I guess you can fly, but FY, this is the first time I've met her live in person, but the second time we've talked, and I've been so incredibly impressed with her knowledge. And that's why I wanted to come in here and experience this treatment. So if you're looking for an acupuncturist in St. Louis, tell them where to go to.
Yes, we are we're in Webster Groves. It's acupuncturestlouis.com. We've got 3 acupuncturists here, so if you can't see me, you've got 2 other people to see. I'm also chair of our national board, so I always give a shout out to our national board. It's nccaom.org. So if you aren't in St. Louis or have relatives elsewhere, if you go to that website, nccaom.org, you can find a board certified acupuncturist anywhere in the country.
Okay.
So
could you also help if they contact you?
Yes,
could
absolutely. Feel free.
Yeah.
I do know because I pre-COVID did travel a lot and speaking engagements. So I do know a lot of people around the country. So feel free to contact me if you need a referral for out of town too.
That's awesome. So thank you all for being here. A couple more people hopped on. Julie from the great state of Montana is on. Maureen from New Mexico. Thank you, Maureen, for being here. Tina's on. Michael asked a question. How long will Mike's back stay red after the cupping?
So for most people, the degree to his redness, I would say most people, it should fade within 24 to 48 hours. In some people, if there was a little less red, usually sometimes even within an hour. So the thing is, it looks like it hurts a lot. It does not. It just looks like it is, but we say it's moving that stagnant Qi in blood. So you get the red. I've had it where a colleague did it on my back after a car accident, and my entire back was black and blue. It looked like somebody beat me. It did not hurt. It helped significantly. But needless to say, when I went to the beach, I had lots of interesting looks.
Well, good thing I'm not going to be making a trip.
You're not making a trip
to the beach tomorrow. Okay, so Michael also said, thanks, Alpha. My daughter is watching and wants to come see you. Fantastic.
All right.
Fantastic.
Check out the website. It'll give you all the information to get a hold of me.
Yeah, so I will make sure that we hook you up and get that taken care of. Ron, so Ron is my father, and he has a lot of spine issues.
Yes.
So he's always looking for, I'm not going to say a quick fix, but something that can really help him. He's got a lot of spinal stenosis.
Yeah.
And he just turned a very young 82.
Awesome.
So how would you kind of take someone like him?
So with spinal stenosis, it does depend on how narrow the canal is. I always tell people degenerative disc, as long as you're not bone on bone, I can definitely help decrease the pain. In some cases, it'll take it completely away. One of the things that tends to happen with people with spinal stenosis is that often it's not the spinal stenosis that's causing the most problems. It is actually the muscle tension around the spine that is causing the problem. So while I can't necessarily fix the stenosis part, I can definitely help with everything else around it. So a lot of people are surprised that it helps with the spinal stenosis diagnosis, but it's really because it's decreasing inflammation and working on the muscles.
Absolutely.
Yeah.
Sounds like you know who you need to come to, Ron, to get that taken care of. Melissa's on, and Dr. Matt Bruckle from Total Access Urgent Care. Welcome, Matt. Well, thanks for joining. And my good friend Tim from the state of Michigan. So, oh my God, we had people all over the world, at least all over the United States here, meeting you. So thank you. My dad wants to know, is it covered by Medicare? Does insurance cover acupuncture?
So in Missouri, and it does vary state to state, in Missouri there is very little insurance coverage. Medicare has authorized acupuncture for low back pain. So if you are a Medicare recipient, the challenge is that they're still working out the kinks with that because they kind of passed it real quick without really working out a lot of the kinks. So unfortunately, I can see people who get Medicare, but I can't bill Medicare unless I'm working under a physician who is an official Medicare provider. But we're working on that. I will do some research on my end. If you contact me, I can try to see if there's anybody around town who has made an arrangement with an MD or working like in an orthopedist office, because right now that's the only way that we're able to really cover it within Medicare. But it is coming. I've been working on a number of policy papers for Medicare, so it's looking like that's going to expand.
Oh, good. Fantastic. Do any of the private insurances cover acupuncture?
Some of the private insurances do, depends on your plan. So for example, United Healthcare has some of their plans that cover acupuncture, same with Blue Cross Blue Shield. I will say it's spotty, very spotty.
Does it depend upon diagnosis or?
It depends strictly on what plan you have, and every insurance has like thousands of plans.
Oh, yeah.
What I tend to find is that people who are at executive levels, they get the Cadillac plan. Federal judges have Cadillac plans that cover acupuncture.
So if they, I was just curious,
Yeah.
when you see them, do you give them like a super bill or receipt that they then
Yes.
submit? Because you don't actually
Yes.
submit to the
I don't actually submit.
Okay.
If you do have a health savings account, an
Yeah.
FSA or HSA, acupuncture is considered
Perfect.
a medical procedure, so you can get reimbursed for that. So that's really the majority of closest to insurance that I have is people who are using their HSA accounts.
But it's good, at least,
Yeah.
at least there's options.
Yeah, there are absolutely
You know,
options.
It's not a hard, fast no.
No,
There is options.
right.
There is options.
So, and call your insurance companies. We continue to encourage people, tell your insurance companies you want acupuncture coverage. The more people let their insurance companies know, the more pressure they get. So,
one of my favorite sayings is that if you don't speak up, you're going to get the crap that's handed to you.
yes.
So if you want to change something, you need to speak up and start making phone calls and be that voice. And I think that Monday we had a motivational quote, which was the one from Gandhi. What's the one from Gandhi? Be the change.
I'll be the change
that
you want to see.
Yes, yes. So start making those calls to your insurance companies and put them on the spot, please. Put them on the spot. Chris from SSM is on. We have such a great group tonight. This has been great. So I want to thank you for your time.
Thank you for coming. Thank you all for coming and participating.
I will, tomorrow I will post your information on my Facebook page. And thank you so much. I feel great.
Awesome.
And I've never had that cupping, and so it was awesome.
You got 2 new experiences.
Yes, 2 new experiences. Do I have any blood on the back of my shirt?
There's no blood.
That's why I wore a white shirt today, because I wanted you to see if there's any blood. But
no blood.
It was painless. Trust me, painless. So, thank you all for being here. Real quickly about the Facebook Lives. You know, I started off with 3, then I went down to 2, and then I went back to 3. So, starting next week, we're going to do 2 Facebook Lives. The one on Tuesday is for my pain-free golf group. So if you're a golfer, and even if you're not a golfer, we talk a lot about health issues, wellness issues, back pain, knee pain, all those things. So even if you're not a golfer, join that pain-free golf group, and you can get in to see my Facebook Lives I do Tuesday with that group. And then Thursday we will continue to do the Welcome to the Community interview. I love it. You guys get to meet such great people, so we'll continue to do that. So check me out on Tuesdays and Thursdays, and have a great July 4th. Be safe, of course. Be careful with the fireworks. We don't want anyone to go see Dr. Bruckle at Total Access Urgent Care. That would not be good. So,
that would be bad.
all right, so as always, stay home, stay strong, and have a great holiday, and we'll see you on Tuesday or Thursday next week. Take care. Bye-bye.